Alright, my name is Heather Lieberman, and in this video I'm going to be demonstrating a modified knots test. The idea behind this test is to concentrate microfilaria, and we're specifically differentiating between Dirofilaria immitis and Acanthotrilonema. The Acanthotrilonema is going to have a more blunt head, and due to the formalin that we're using in this procedure, it's going to fix the tail. It's going to create like a fixative effect that creates a whipped-like tail. Some of the supplies that I'm going to need are some formalin. I'm going to need 1 ml of anticoagulated blood. I got my 15 ml Conco tubes, some pipettes, and then down the line I am going to need some methylene blue to stain my sediment. Okay, so to start I'm going to measure out 1 ml of my anticoagulated blood. Just going to invert it a little bit here, mix it up. Now I'm using a pipette that I will be measuring up to the 1 ml mark. Okay. So here I have one that's already set as a balance, so I'm using this tube right here. And I'm going to be putting my 1 ml of blood into there. Okay, and then adding to that, I'm going to add 9 mLs of formalin. So let's get that out of my container here. I'm using a 10 ml syringe to help myself draw up this. So 9 mLs there. I'm going to add that into my test tube. I do want to gently mix this. So I'm going to put my thumb over there and just gently invert my sample. Okay. So I'm going to set this down real quick just because I did get a little bit of formalin on my glove. Don't need to be spreading that around. And then we're going to come over to the centrifuge. Okay, we're going to spin this for 5 minutes at a rate of 1500 RPM. So grabbing my balance and my sample, we're going to come on over here. I'm going to place these balanced in my centrifuge, and then over here I'm going to turn this down to 15 and 5. We'll get started. Okay, sounds good. Alright, we'll be back in 5 minutes. Alright, so my sample has finished spinning. We're going to take it out. So I got my balance here. We'll just set that over here for now. And I got my sample right here, so you can see my sediment here. So we're going to pour the supernatant off here. Sorry. We're just going to dump that right out. Okay, so that's my sediment that I have. And I'm going to add 2 drops of the methylene blue stain. And then with a pipette, I'm going to kind of mix my sample now here with that stain. Okay. Got a good mixture going on here. So now what I'm going to do is I'm going to grab a microscope slide. I'm going to give myself a little bit more workspace here, and I am going to need a cover slip, but let's grab that. Have it handy. Okay, so I've got my cover slip, so I'm going to take 1 drop of my sample. Got a few air bubbles here. Let's see if I can knock those out a little bit to help me. There we go. Alright, and then I'm going to put my cover slip on. Okay. So next we're going to see what we got going on here. So I'm starting at a scanning objective lens. I'm going to move this out of my way. Give myself some more space. I'm going to bring my slide all the way, or my stage all the way down, just to start new. We're going to get going here. So I got my sample in place. Move it on over. take my gloves off just for comfort. Okay. We're going to start focusing. Got that nice and good. Do maybe want to adjust my light just a tinge. Okay. So I'm nice and focused here on scanning. I'm going to switch on over to low power. And I'm going to start kind of observing a little bit here. So just start scanning through my sample. And I can adjust as needed as I'm scanning. And I'm looking for those microfilaria. So far, nothing. Okay. So I'm going to switch on over to my high power now. Refocus. Alright, there we are. And then again, I'm going to kind of just search through my sample here, looking for any of those microfilaria. So I'm not seeing any microfilaria in the sample, so looks like that's good news for this patient. Okay, so that's how you would do a modified NATS test. Hi, Heather Lieberman here again, and in this portion of my fecal diagnostic videos, I'm going to be performing a basic fecal float. The reason we would be doing this would be to be searching for any parasitic eggs. So the idea behind this is that the fecusol has a higher specific gravity than the eggs do, and so that would force the eggs to float to the top. Unfortunately, with this method, the fluke eggs typically stay at the bottom because they are so dense. So you do miss those generally with this method, but it is also beneficial in finding any kind of parasitic eggs. The supplies that you need would be some fecusol. I'm using some zinc sulfate solution today. Another option would be sugar solution. So there's a few different ones on the market that you can use. So that's what I have today. The other supplies that you will need throughout the procedure kind of varies on how you're doing it. So today I'm going to be using a fecalizer. Kind of simplifies the amount of equipment that you need, but there is the option to do it in a conical test tube. So that would be what this is. This is a 15 ml conical test tube. The idea of what you would do in that procedure would be mixing 2 to 5 grams of feces in your little cup with 30 mLs of your solution. You would use a tongue depressor to really mix that up really well, and then kind of form a little spout with a cheesecloth or a gauze kind of over the top to help pour that through. You would want to get your meniscus and then place your cover slip on top. So for me, I'm going to use my fecalizer here. The nice thing is it has like a little indent here that is geared for the amount of feces that you need. And then it does have little measurement increments on here. So to start, I'm going to go to this bottom line with my solution. Okay, so what I did is I did pour some of my solution into this cup here, just to give me ease with drawing it up. So I'm going to start there. Let's get some of my fecusol, and I'm going to fill it to that line. Okay, about such. So I'm going to take my stool sample here and just get a good sampling and fill that little indent with my stool. Guess I could give it a little more. Okay, so then what I'm going to do is insert this into my fecalizer and make it into a little slurry. Just mix that up really well, and here I'll move my hands so you guys can see better what I'm doing. Mixing. Alright, so then I'm going to lock that kind of down into place, and I'm going to fill this up to get that meniscus at the top here. So just filling. I'm going to kind of get down at eye level here just so I can keep an eye on that. I do need a little bit more of solution here. Again, coming back down. Alright. So, the idea here now is everything's going to start floating up. I don't know if my camera woman is able to kind of get a better glimpse of that meniscus, how it's kind of a bubble up there. But if not, we're going to go with it. And next step here is I'm going to take one of my cover slips. Hopefully just one this time. I know last video I grabbed two. And I'm going to set that on top. So the idea is all of that is going to adhere to that cover slip. I'm going to let that sit for 10 to 20 minutes, and we'll come back and we're going to put that onto the microscope slide. Alright, so I'm going to let this sit for 10 to 20 minutes. We'll be right back. Alright, so we waited our 10-15 minutes, actually more close to. So we're going to pull the cover slip off, and we're going to place that liquid side down onto the microscope slide. So I'm just going to gently take that up and drop it right onto my slide. So from there, I would take this and I would go to the microscope. I would start with scanning objective lens and then work up to high power, and that is where I would read this, looking for any of those parasitic eggs. Alright, so in my next video we're going to be doing a fecal float but with centrifugation. So let's move forward with that. Heather Lieberman here. In this video we're going to do a direct smear, fecal smear, okay? So what I need here are some microscope slides. So I have one kind of prepared here in my little workspace. I will need some cover slips. I have a wooden stick that I'm going to use to help apply the stool to my slide, and then I do have some saline. Okay, so to start I'm going to put a little drop of saline onto my slide, and then I'm just going to get a very small amount of stool that I will adhere to the end of the stick. So I'm just going to kind of roll it in there, get a little nasty with it. Alright, so that's a decent amount. Now, the trick here is I don't want this to be too thick. I want to be able to read through this if possible. So I'm just going to start kind of rolling my stool into this and just make it a nice little layer. Get in there. Spread it out a little bit more. There's a little hair that's kind of catching some of the debris. So from there what I would do is I would take one of my cover slips and just kind of place that over my stool. There will be a little bit of air bubbles in there. Oh, I grabbed two. That could be part of my issue too here. So then what I would do is I would take my slide, I would put it on the microscope. I would start obviously with scanning, kind of get things in focus, and then from there I would move over to low power and I would start observing. So things that I would be looking for are any eggs, larvae, cysts, like giardial cysts, or trophozoites, again giardia. So I would be able to potentially see any of those if they were in this specimen. And then I would take my recordings and give that to my veterinarian. The downside to using this kind of fecal diagnostic is that you're using a very small amount of sample. So potentially if it's a small parasitic load that this patient has, you could be missing something. So that is the downside to it. But at the same time, you don't need a lot of samples, so it's nice because you're able to easily make a slide and observe it to try to look for any of those parasites, cysts, eggs, etc. Okay. Alright, so for this next video, we're going to be doing a fecal flotation with centrifuge. The benefit behind this is you get a little more accurate results with less time involved. So the supplies that I'm going to need, I'm going to need some conical 15 ml tubes. One is going to be for my sample, the other one is going to be for a balance for the centrifuge. The other thing I will need is 30 ml of my fecal solution, using again this zinc sulfate, which I did pour some into this cup again just for ease of drawing it up. And then I'm going to need my stool sample. In regards to the size or the amount of stool sample I need, they say about 2 to 5 grams. And for kind of a visual reference, they say a Hershey Kiss is about 4.5. So I'm going to kind of get a size of stool that's relatively close to the size of a Hershey Kiss. So let's start there. I'm going to mix that into a little cup. Okay, so I'm going to take my stool, mix that into my cup here with 30 ml of my fecal solution. So I'm using a 20 ml syringe here. Got a little air. Now we're just going to start over. Get down over here. Alright, there we go, that's better. So I'm doing 20, adding that to my stool, and then another 10. I'm adding that in here as well. So I'm going to take one of my tongue depressors, and I'm going to mix this up best I can here. Still a few chunks here. So again, same as the basic fecal float, we're again looking for any parasitic eggs, you know, that should hopefully float up. Going through the centrifugation is definitely going to give us a little added oomph, I guess you could say, to bring all of that up. Alright, so I got a nice little slurry going on here. I'm going to take a piece of gauze, you could use a cheesecloth as well, to kind of filter this solution. So kind of different from the basic float where you're not necessarily filtering it, this one you are, okay? You can also use a funnel to help kind of aid you in pouring your sample. We're going to give it a try here. Alright, we're going there. Slow and steady here. If you have the proper centrifuge, you can definitely fill this up to where you're going to get that meniscus again, and you would place your cover slip over it. But today what we're going to do is, here we go, we're going to just fill to about 1 centimeter below the rim, and then I will supplement some more solution once this is done spinning. Okay, so we're going to stop there. I'm going to set that on my little tray here. I got some on my gloves, so I'm going to re-glove for transporting my sample over to the centrifuge. It's easier for myself. So what we're going to do is we're going to spin this for 5 minutes at 1500 RPMs, and then we're going to come back and we'll finish it up. So let's move on over to our centrifuge here. But actually, before I move over there, I do need to create my balance. So balance needs to be about the same weight as my sample. You can use water. I'm just going to go ahead and use some of my Ficosol because I got it readily available here. So now that I'm getting close, I'm going to kind of try to get them as exact as possible. Okay, and then I'm going to take that over here and get my centrifuge set up. So let's head on over. Someone locked the lid on me here. We're spinning something. Moving those out. Double checking for any other samples. Alright, so then we're gonna, there we go, we've got some that are a little deeper. So I got those equally balanced in here, and now I'm gonna come over here. I'm gonna drop my time down to that 5 minutes. We're gonna go down to 15. Alright, and we're gonna get things started. Okay, so my sample has been spun down. We're going to get it out of the centrifuge here. Got some sediment there on the bottom. So my next step is going to be filling that up so I can get that meniscus. So we're going to come back over to my little work area here. I guess I really didn't need my balance, but we'll just bring it on over with us carefully. So I need to be very careful with adding this solution. If you create too much pressure with adding it, you're going to push all those eggs back down. So then they're not going to be up on my cover slip like I would like them to be. So again, going back into my Ficosol solution that I have in my cup here, I'm going to very gently just top this off. Filling up on the side here. Alright, so I got a nice little meniscus going there. I'm going to take my cover slip. Okay, so I got my cover slip right here. I'm going to pop that right on top. And I'm going to let that sit for 10 minutes. And we'll be right back for the finishing touch. Alright, so on to our last step of this fecal centrifugation float. So I had placed the cover slip here, we've waited 10 minutes, and now the final step here is I'm going to take a microscope slide. I'm going to gently take my cover slip off of this and transfer it right down onto my microscope slide. So then I would take this over to my microscope and I would systematically go through all of the objective lenses, scanning low power and then get to high power, and that's where I would start evaluating for any of those parasitic eggs or ovas in the stool, and that would be it. Alright, Heather here again, and we're finishing up with our final fecal diagnostic test here, which is a sedimentation. Some of the supplies that I'm going to need are some water. So I did fill this cup with a little bit of water. I have a mixing cup, my stool sample, and then I have a conical centrifuge tube that I will be pouring things in. I have a little bit of gauze for filtering. Down the line, I am going to need a microscope slide. I'm going to need a cover slip. I'm going to need a pipette. So let's get started. Benefits for this test. So compared to the floats, this test is going to be better for finding any fluke eggs. Since they are denser or heavier, they normally sit at the bottom for those floats. So this one is going to give us a chance to be able to find those. So again, I'm going to need about a Hershey Kiss size of stool sample. Don't get them confused, okay? We don't need a sediment of Hershey Kisses here. All right, so we're going to go on into our sample, get a little bit of that. Probably good, no? All right, so I'm going to put that into my mixing cup here. And then I'm adding 30 mLs of water. So I got a 10 ml syringe here. It's going to take me 3 times to get what I need, but that's okay. A little bit of air. Okay, back to that 10, filling that up. Two. And we're doing 3. And I'm going to make this into a nice little slurry again with my tongue depressor, mixing that all up. Okay. So, now that I got a nice little mixture going, get this out of my way, get my little gauze ready, make my little spout with my cup, and we're going to start pouring in our sample. So now that I have this, I'm going to let this sit. Oops, we're making a little bit of a mess. I'm going to make our cover here. So I'm going to let this sit for about 15 to 30 minutes. And then we'll be back to dump off some of the supernate. We'll keep that sediment in there, and then we're going to add some more water. Okay, so we'll be back in about 15-20 minutes. Okay, so moving forward with our fecal sedimentation, I've let this sit for about 15-20 minutes now. So we're going to pour off the supernatant. I got a little bit of sediment forming here on the bottom, so obviously I'm going to avoid getting any of that out. So I'm going to pour that off. Okay, so we're going to leave that in there and put that back, and we're going to resuspend that again, okay? So again, I have my water. We just had to move closer to the sink so we would be able to dump that off. Okay. I think I'm going to leave that like that. And we're going to wait another 15-20 minutes, and we'll repeat this step one more time. Alright, so this will be my final time. I'm pouring off the supernate and then reconstituting it with some water. And then after this time we'll come back and we'll actually apply and make the slide. Okay, so I'm going to pour this off.
Okay. So as far as margin studies, do you recommend doing them on both of them? Really?
Okay, so I'm going to leave that.
Okay. right?
Oh, sorry. Nope, I want to use my thing. I'm going to take my syringe and we're going to reconstitute. So just pouring.
Oh yeah, do not throw it away for at least a few months because she's 100% for sure going, okay? Okay,
All right, so we'll leave that sit for another 15-20 minutes and then we'll be back to finish it up. Okay, so we're going to finish up our fecal sedimentation now. So I'm going to dump off the supernate. See if I can get a little bit more without ruining my sample. So I do have my sediment down there. Ideally, don't want to dump too much off. I'm going to leave it. It's kind of staying in the tube. So what I'm going to do from here is I'm going to grab a microscope slide and I'm going to pipette some of that sediment onto it. I got my microscope slide. Alright, so I'm going to do that, set it down so I'm not spilling anything, and then I will cover that with a microscope cover slide. Apparently all of them want to stick together. Here we go. Okay, so again I have my sample there. I'm just going to let that sit in there. So what I would do is I would read through this entire slide. Read through that entirely. Again, with this specific method, I'm going to be looking mainly, or I'm going to hopefully see fluke eggs if there are any, given that we're looking at the bottom of the sediment here. So again, I would just keep remaking slides and look through that entire sediment, and then that would be the end of it. So that's how you do a fecal sediment. Alright. Heather Lieberman here again. In this video we're going to be demonstrating a free catch urine. So for this sample it is not considered a sterile sample. We would use this for a basic routine urinalysis. The thing is, some of the key things we want on this is to do it in the morning. That is ideal because the urine is going to be most concentrated and you're going to find the most formed elements in the urine that way. Another benefit to, or another thing you want to focus on is getting the midstream of the sample. So I want to let her, we're using fish today, she's helped me out. She's going to urinate a little bit before I start collecting that urine, just to avoid any contaminants from the external portion of her urethra or vulva in this case. Okay, so we're going to head outside. It's snowing here in Michigan right now, so we're going to try to get as little bit of snow in the sample as well. Let's see what we get. Alright, I got my good friend Ashley here. She's going to help walk the fish for me. She's a powerful girl. I know, let's go potty, girlfriend. What? Can you go potty? Oops, sorry. Come, go potty. Alright. Go potty.
Yeah, we weren't here that much that week after the snow.
Right.
Good girl.
Alright, so I'm getting under there, avoiding the snow.
So did they give you feedback?
So I would say that fish's urine is a pretty dark yellow color, and probably slightly cloudy given on what I'm observing here. So we would take this inside and run a routine urinalysis on this. Alright, so for this urine collection video, I'm going to be demonstrating a cystocentesis. A cystocentesis is kind of the gold standard for a sterile sample of urine. So there's a couple different ways you can go about it. Today I'm going to be demonstrating an ultrasound guided cysto. You can also do palpation, where you're actually feeling for the bladder, isolating it, and then you'll poke from there. And then the other way would be a blind stick. Kind of what you would be doing in that situation is you would be placing some alcohol on their abdomen. For a female, you can kind of go where the alcohol pools. You would be wanting to go caudal to the umbilicus and along the midline. For a male dog, you're going to still be going caudal to the umbilicus, but to the side of the sheath. Okay, so I do have a couple supplies here. I have my 6 ml syringe. For drawing my sample, I'm going to use a 1.5 22 gauge needle. I have some gauze and alcohol for cleansing the area. The alcohol is also going to help aid in the ultrasound being able to read. And then I have some plain top tubes, so that way I would transfer my sterile sample into those. And I'm going to switch my needle out before doing so. Alright, so let's get started here. I'm going to prep my syringe. Okay, got that all set up there. I'm going to set that next to me. And then I'm going to just kind of cleanse the area where I probably will be drawing my sample from. I know, buddy, it's a little cold. Okay. Flip this over. Just do a nice wipe. And then I'm going to just kind of saturate it with some more alcohol. Alright, so I have my ultrasound probe here. And I'm going to find his bladder, which, if you can see, is all of this dark space right here. Okay, so I'm going to take my syringe and I'm going to come to the front of my ultrasound probe and I'm going to go down. And I can actually see my needle in the bladder on the ultrasound. And I'm going to start aspirating the urine. I'm going to stop and then pull out. Okay? Put this back. Alright, I'm going to recap this really quickly. So, see, take that needle off and I'm switching it out. Alright. And then I have my plain top tube here. I'm going to fill that with some of my urine. So this one I could say I would reserve for my culture if I were doing one. And then I could use this one for like my in-house urinalysis. Okay? So that is how you demonstrate or do a cystocentesis. Hi, my name is Heather Lieberman. My student ID number is 3309 and this is my catheterization for a urine for my clinical pathology 2 class. So over here I have the supplies that we're going to use today. Back here we have a little bit of chlorhexidine scrub that we're going to use to clean his penis. We've got some syringes here to collect the urine in. These are gloves for cleaning the for when we clean the penis. We have some sterile lube, which we have not opened yet. We have a red rubber catheter. There are a few different catheters that can be used. So this is one of them. The other kind is called a polypropylene catheter, which is a clearish plastic material. And then there is a Foley catheter, which is used for catheters that are going to be in for a long term. It has kind of like a balloon at the end that you will inflate to help hold it in place. We're using an 8 French today for Mr. Vader here. We also have some scissors which will be used to help cut the tip of the catheter down here to better fit the syringe, and then some sterile gloves. Helping me today I got Kate Josephson over here, LVT, and then one of my preceptors, Dr. Sharon Napawaki. Alright, let's get started. So we have Vader in lateral recumbency. Another option would be in dorsal recumbency on his back. And to get started, we are going to kind of start prepping things. We are going to clean him as well. So I'm going to actually clean the penis for Dr. Napawaki today. Okay. So I'm going to not make too much of a mess here. I'm going to start by extruding his penis. I know, I'm sorry, buddy. So we got it out here. And we're just going to cleanse the tip. I know, it's cold. Just going to get some of that external area as well. I'm not going to set that. I'm just going to put that right there. Alright. Would you like me to keep his penis out?
Yeah.
I think he might let me.
Okay, so I'm going to get my sterile stuff ready.
So Dr. Napawalki's
that.
getting that all together.
Let's do this.
Doesn't want to open. So the reason behind having 2 syringes today, one of them we're going to use for the beginning of the sample, which we'll want to discard, just in case we have any extra contaminants from when we insert the catheter. And then the second one will be the portion of the sample we would actually want to use for any diagnostics.
I'm opening the sample for the sterile.
Oh boy, buddy. So part of our preparation too will be kind of deciding where his bladder actually is, so we aren't going in too deep. So we expect his bladder to be right here in the caudal abdomen, so we're gonna kind of think it's gonna take up a good amount of that catheter.
Okay.
Alright. So we're lubricating the catheter. And if I need to pass it on you, let's see how awkward this gets. I know, buddy. Alright, so she's inserting it. Alright, just seeing if we're where we need to be. Go a little bit further. Alright, so we got a little bit of sample, so she's going to want to disconnect, discard that. And we're in. And then we're going to pull a little bit more sample. So this would be what we would want to use for any diagnostics we'd be running. Alright, and we can disconnect. Alright, and then we're able to pull out that catheter slowly, gently. Meter's still going a little bit. Alright, and that would be a catheterization for a urinalysis. Hi, Heather Lieberman here. In this video I'm going to be demonstrating an ear cytology. So a lot of times we'll have clients coming in complaining of their pet shaking their head, scratching at their ears. Sometimes they have an odor that they notice or just debris coming out of the ear, which would warn us to want to run an ear cytology. So Louis here is our hospital cat. He's not always the most cooperative, but he's going to be my demonstration for collecting the sample. Earlier today we did have a patient come in who was having symptoms of an ear infection, but the owner declined me videoing it. So we saved those swabs for my cytology purposes, but for demonstration of how to collect the sample, we're going to use Mr. Louie here. We always want to do both ears. Just because one of the ears it seems more symptomatic doesn't mean that there isn't potentially infection brewing in the other ear. So that's why we want to do both of them, whether or not they both seem symptomatic or not. To keep things kind of, I know Lou, to keep things under control, or so I know which swab is which, I do break my swab for the left ear, and then I keep my right ear whole. Okay, so I'm going to go ahead, I'm going to start with his left ear. You want to get down into that ear canal. You don't want to stay on the upper area of the pinna. So kind of flapping that ear back, and I'm going to get down into that ear canal. Obviously I don't want to go too far to where I'm causing any harm, and then just kind of getting that swab all along the walls of that canal. Okay, so that would be my left ear. I know, buddy, you're doing good. And then we're going to come over to the right ear here. Okay, hold still, bud. We're going to flip that ear back again. And we're going to go ahead and just swab around that ear canal, okay? So then what I would do is I would take those to create my slide. So let's do that. We'll come over here. Again, I'm going to use the swabs from the patient who is showing symptoms of ear infection to hopefully give me a little more of an exciting ear cytology to read. So what I will need is my microscope slide, okay? So I just grabbed that. I like to keep my left ear on the left side of my slide when I'm looking at it, and I kind of make a little L. So I kind of roll back and forth this way, right to left. And I kind of come out and make a little L, and then I do almost a little pattern the other way. Just really rolling that out. You do have the option to use a lighter to kind of fix your sample. It also helps kind of dilute that ceramune, so that way, you know, if it was too thick of a sample, it could help that way. So now I'm applying my right sample on the right side of my slide. Okay, so then we're going to come over to the stains. There's a 3-step Romanowski process here. So we're going to start with a fix. The fix, we do leave it in a little bit longer. So I'm going to leave it in for about a minute. And then for my 2 stains, I'm going to leave it in for anywhere from 15 to 30 seconds. Just kind of depending on how dark you like it or how thick of a sample you have. Another factor could be how old your stains are. Alright, so got the top. That way I know this is the top of my slide, and I'm going to put it into my fix here. Alright, and I'm going to let that sit for about a minute. So let's time that out. So we do have our stains labeled. The ones that I'm using are for ear and skin. We also have one for fecals and then blood. So they are separated just to prevent contamination between the different samplings. We're at the 30-second point here. So we do clean our stains about once a month here. I did freshly clean this one this morning, so we had it nice and fresh for our video today. Alright, here we go. We're getting to that point. So I'm going to switch on over from my fix into my EUSIN. So that is my second stain, or I guess my first stain technically, second portion of staining. Okay, so I'm going to let that sit. It's been about 20 seconds now, so we're kind of at that halfway between 30 and 15. Flipping on over. so next what I'm going to do is I'm going to rinse my slide, and then I do need to let it air dry. Okay, so once it's air dried, we'll be back, but let's first rinse it nice and well. Alright, and then I'm going to have it kind of propped up here to air dry, and we'll be right back. Alright, so we're going to finish this last portion of the ear cytology. I've allowed my slide to dry, so I'm going to start examining my sample here. So we're going to start with our scanning objective lens, just to kind of find our place, get things focused for ourselves here, and I'm starting with the left ear. Okay, so let's go. I'm going to turn my light down just a smidge and get my coarse adjustment knob going. Alright, so I'm getting some stuff in focus here. Looks good, so I'm going to switch on over to my low objective lens, low power. And using my fine adjustment knob, I'm going to clarify things a little bit. Alright, looks good. Alright, so from here I'm going to use some immersion oil. I'm going to kind of come in between objective lenses, and I'm going to place one little drop onto my slide. Okay, like such. And then I'm going to switch into oil. Okay, and from here I'm going to zoom out, find my place again. Alright, so we're looking around here, getting things into view. So I'm seeing a few epithelial cells in this field. Just my fine adjustment knob, just kind of as needed. Alright, so in this field, I actually see two little yeast buds, two little cuties hanging out. There's one epithelial cell up here in the left corner area. So I'm going to keep going. Just kind of keeping track of where I'm at here. And in this field, we actually have a couple more epithelial cells. And then to the right here, I do see a couple more yeast buds. Okay, so we're going to go up into another field. And then again, we have another little yeast bud just by himself here. So far I'd be saying that there is a rare amount of yeast in this sample. Okay. Again, just a couple epithelial cells. A little debris throughout all these fields, really. Oh, and then we found a couple more yeast buds. Again, just two, so we're sticking with the rare yeast in this ear. So that was my left ear. So I'm going to start all over again just so I can make sure I find my place. Some people just easily swoop right over to the right ear, but I'm going to start over. So I'm moving my slide over to where I can notice my right ear swab is, kind of center it there, and again I'm going to go through all those steps. So just kind of get a good adjustment here. Alright, good. We're going to go back to low power, just kind of focus in. Looks good. Alright, so then we're going to again go back to oil. Okay, so I'm going to put another little drop, little one right there. And get my oil lens in, kind of smooth it out, and then we're going to adjust. Alright, and I'm zooming in. It looks like I already got an epithelial cell right there, hanging out all by himself. Start floating through some of these fields. Alright, so here I have another epithelial cell. Keep going up. We have an epithelial cell with a yeast bed up it to the left. Focus a little. Alright, nothing so much, just some debris. A couple more epithelial cells. Alright, in this field I do have a couple more little cute yeasts hanging out. We got 2 of them. Alright, so I would just keep doing this. Normally you do this for about 10 to 14 fields, and then you would give your diagnostics to the doctor or what you've concluded from here. So if you were to ask me, I would say there's some epithelial cells present with some rare yeast. And that's it for my ear cytology.
Hi, my name is Heather Lieberman. My student ID number is 3309588. In this video, I'm going to be demonstrating a skin scraping. I got my boy Vader here, and I got Leanne, who's another assistant here with me, and we're gonna get this taken care of, okay? So some of the supplies that I'm going to need are a 10 blade. I have a slide here, and some mineral oil. Okay, so the reason that we would be doing this would be checking for external parasites, more specifically any kind of mites. Mites can live more on the surface of the skin, and some live more deep into like the hair follicles. So doing a more superficial scraping would be testing more for the parasites that are living more on the top of the skin, where doing a more of a deep scrape would be testing for ones such as like Demodex that like to live down in the hair follicle. Where you would choose to take your sample would be any areas that are kind of showing symptoms. So thinning of hair is kind of a red flag. And so if you need to, you can always shave with a 40 blade that area to just kind of give you more of a clearer area. So on Mr. Vader today, I'm going to go kind of in this thin area up here, right here for him. I'm going to prep by putting a little bit of mineral oil onto my slide. I'm going to open up my blade here and just kind of, I guess you could say, wet it in my mineral oil. And I want to kind of keep the blade perpendicular to his skin. I'm going to do a quick pinch kind of here in this area and just scraping. I know, buddy.
Okay.
I know.
Good job.
And what I'm looking for here is just getting a little bit of, I guess you could say, blood from the capillaries, knowing that I've gotten deep enough. And then I'm going to take that sample and kind of smear it into the slide. All right, so from there, I'm going to take it and get it up on my microscope here. And what I want to look at this at is the low power, or the 4X. So I'm going to get it all positioned here. Get it nice and centered, and then I'm going to start adjusting. Sorry, I need to take my glasses off. Starting to get some stuff in the field here. Now, if I were to see any kind of mites, they would be visible. So right now I'm seeing some hair follicles, some hair, some debris. A little bit more debris. So luckily for Vader, I'm not seeing any mites, which was what was anticipated. But if I were to, they would be present in my sample just looking at the low scanning. Okay?